Okay, can you give me a thumbs up? Can you see my presentation there? Perfect. Okay, so we will get started. So let me go on to next slide. Perfect. So just a little bit about me to get started. So my name is Jessica Manuel. I am a registered physiotherapist with Aramasa Physio. I currently work at two of their clinics, one being in Acton and the other one at the Health and Performance Center at the University of Guelph. Prior to that, I did my undergraduate degree in kinesiology at McMaster University, and then I stayed at Mac for another 2 years to finish off with my physio degree. Following my degree, I went on to do my sport physiotherapy fellowship at the University of Guelph, and so I am working towards becoming a fully registered sport physiotherapist. For today's agenda, we'll start off by talking about the gait cycle, going through each of the phases of gait, and then we'll break down common injuries and ways that gait cycle may actually go wrong. We'll then talk about how to prevent those injuries from happening, and then we'll leave time for questions, or in this case, even if you have any questions to email me, I'll send you guys my email. Perfect. So to get started, let's compare running versus walking. So quite simply, we have a few differences in terms of the demand when we begin the running cycle. So for instance, we have a greater need for balance, and that happens because there's this introduction of a double float phase versus in walking, we have this phase of double stance, meaning that both feet are on the ground, versus in running, there's a phase where there are no feet on the ground. The second way that running is a bit more demanding is that there is greater range of motion required through many joints, including the shoulders, hips, knees, ankles as well. And then the muscle strength that is required to run is far greater than to walk. And with that comes a greater need to absorb those forces that are created while running. So in the running cycle, we see ground reaction forces increasing by 250% compared with walking. So that was a brief introduction, and now we'll talk about the gait cycle. So starting off, when we talk about gait analysis, we will always talk about one leg at a time. And so when we talk about the stance phase, we're talking about the limb that is in contact with the ground. So in this image here, you can see that it is the right leg here that we'll be analyzing when we talk about the stance phase. So the first phase of stance phase is when we are initially contacting the ground. So the heel strikes the ground, the knee will flex, and the foot will pronate, which means that the arch will drop, and all of this acts to absorb shock and impact. The second phase of the stance phase is mid-stance. This is when the leg is providing that stable base for our body weight to pass over. So the body weight is passing just over our midline, which is kind of that second image there. And then going on to the third phase of the stance phase is our propulsion phase. And this is when we're generating force to propel our body weight forward. And the heel will lift off of the ground. You'll push through that big toe. The knee and the hip will extend to propel our body weight forward and advance us onto the next step. So let's actually just break that down a little bit further. So this is a hot topic that's often debated within the running community, and that's foot strike. So at that initial contact phase, where is your foot actually hitting the ground? And there's lots of debates about which is better, but we'll talk about both of them a bit first. So a forefoot striker is the third foot that we see here. And that is when we contact the ground with our forefoot, or closer to kind of the ball of the foot, I would say. And when that happens, we see that there's an increased loading through the ankle and into the Achilles, which can, of course, lead to a tendency for more Achilles tendon issues or ankle injuries happening if you are that type of runner. On the contrary, we also have some people who are a heel striker, and that's when the heel contacts the ground first. That will increase loading through the knee and the patellofemoral joint, which is the joint that joins the kneecap with the thigh bone or with the femur. When you strike the ground with your heel, it often causes a bit more ground impact. So there's more forces that the body has to absorb, which often leads to people thinking that this is the worst way to run. When you have this type of runner, you'll often see more knee and patellofemoral pain happening. So the question that's probably in a lot of your head is which one's better, which one's worse. And as you can see, there's injuries that can happen with both of these types of runners. And so it's not a matter of which one's better or which one's worse. It's more so about which one's better for you. If you're someone that might be prone to knee and patellofemoral pain, then we might introduce more of a forefoot strike to offload some of the impact happening into the knee. And the contrary is true for a forefoot striker. Really depends on your goals and some of your injury history. Now we'll move in to talk about the swing phase of gait. So this is when the leg is in the air, essentially. So we can see here it's the left leg on that first person in the image. And so within the initial swing phase, we'll see that the hip will begin to extend, the heel will lift off of the ground. We transition into the mid swing when the hip and knee begin to drive forward through the past the body there. And then the terminal swing phase as the leg starts to unfold and prepare again for that initial contact to restart the gait cycle and restart that stance phase. The last piece of the gait cycle that we don't talk about too much, but is a really important point to consider is what's the rest of the body doing. So the head, arms, and the trunk, and sometimes you'll hear this being called the hat in the running community. So results from a 1990 study was an interesting study, and despite it being on the older side, they actually had people run with their arms tied behind their back or tied to the front of their chest and made them run on a treadmill, essentially. And what they found was that there was a 4% increase in the energetic cost and then 8% increase in the metabolic power demand compared to running with a natural arm swing. So not only is it more efficient to run with your arms because it feels nice and natural, it's also going to demand more of the muscles if you don't have that natural arm swing and trunk rotation. The other piece that's really important, the trunk and the arm swing is generally happening because it's trying to basically counteract that angular movement. So that side to side body sway, it counteracts that and allows your head to stay facing forward. If you don't have that rotation happening, it'll be really hard to stay forward on track. The last piece that we see, running without that arm swing actually increases your step variability and increases the variability within that gait cycle. So we saw that there's a variability within step width, so how far apart your feet are when you're running, and then step frequency, so how frequently is your foot making contact with the ground. So introducing more variability without that natural arm swing. That concludes, that's kind of an overview of the gait cycle and how running happens through our body. We'll now start talking about some common injuries that we see. And of course, this is going to be majority focused on the lower extremity. So we'll start up at the knee, work our way down towards the ankle, the leg, and the foot as well. So let's start off strong by talking about what we call runner's knee, or in the medical community, we'll call this patellofemoral syndrome or patellofemoral pain syndrome. It's a mouthful. This is that it makes up a majority of what we see in running related injuries. So about 13 to 30% of medical consults are for this runner's knee condition. This is essentially pain that is around or behind the patella or the kneecap that is aggravated by an activity that loads that joint during a weight bearing on a flexed knee usually. So to orient you can kind of see the knee on the right-hand side. So the patellofemoral joint that we're talking about is the kneecap and how it sits on the femur, or how it sits in the groove on the femur or the thigh bone there. When we were running, there are forces that we talked about are about 2.5 times the body weight, which is then transmitted up the knee and into the patellofemoral joint, which results in the quadriceps squeezing the patella into that groove even more. And those forces lead to 4 times the body weight going through that patellofemoral joint. So lots and lots of force is going through that small area. And because of this, the body's smart and it was built in a way that is somewhat allowing for this to happen. What we see is that it's actually the thickest articular cartilage in the body. It's found right at that patellofemoral joint. So what types of things cause this? Because not every runner will experience it. So things like, first of all, your anatomy. Can't always change your anatomy, but it can affect how those two joints are situated, as well as an impaired quadriceps function, altered foot, hip, and trunk kinematics. So weaknesses or tightnesses within that chain can lead to poor loading within the joint, essentially. On the side, so as we see at that bottom right corner, there's other things that can come into play. As with most injuries, it's not just a matter of anatomy and kinematics. It also has to do with our capacity. So what's going on daily in our life, stress, anxiety, sleep, fatigue, all of those things will decrease our tissue tolerance, decrease the capacity for our tissues to be able to handle those loads. So always think about your load versus capacity. Common recommendations that we will give people in clinic who present with this type of condition is that we want to keep pain low. So initially, we're going to recommend that we're keeping pain under 2 out of 10 or below, and that's 10 being the worst pain and 0 being no pain. We want to start to reduce distance and speed. So an activity modification is going to be key in the first little bit, and then followed by that graded activity to return back to sport. We might also see an altering of running patterns. You might already be thinking about this because we suggested earlier that perhaps a 4-foot running pattern might decrease the load through the knee. So that could be a helpful recommendation, as well as to tell someone to run more softly so they're absorbing a bit more into their ankle, and then to increase the step rate. So we're taking a bit smaller steps to decrease the forces that are going through the joints. And then lastly, of course, strengthening through that lower extremity and into that lower chain. The next condition that we're staying at the knee here, so we'll talk about IT band syndrome or ITB syndrome. This is an overuse injury that often happens as a result of the repetitive friction at the iliotibial band or the IT band over that lateral femoral condyle. So you can see it circled in red there. That's the common site of IT band syndrome. And that's right where the IT band is kind of rubbing over the lateral or the outside part of the thigh bone there. The contact between the IT band and the thigh bone occurs when the knee is bent about 30 degrees, and that's commonly kind of known as the impingement zone, despite that not always being super well supported in the anatomy literature. That's why there's a bit of a question mark there. There also is theories that there is this kind of chronic inflammation of the bursa, which is between the IT band and the thigh bone, so that can become inflamed as well and can be a source of discomfort. Some risk factors. So excessive running in the same direction, actually. So that causes that internal rotation just one way, can lead to excessive friction between those spaces. A greater than normal weekly mileage schedule. So you're increasing your training, and your capacity to tolerate that level of load just wasn't there quite yet. And again, we see weaknesses, and especially in this case, we see weaknesses in the gluteal muscles. Well, recommendations then will mirror that. So change the direction of running on a track if you are a track runner, strengthening through the glutes, and then stretching through the TFL muscle. And that's because as we look at the image here, the tensor fascia latae or the TFL, it's connected and it directly feeds into some of the tightnesses that can occur through the IT band. We'll move on to another kind of hot topic, and that's running and knee osteoarthritis. And we see it a lot. We see a lot of people wondering if running is good or if it's bad for your knees or if it's going to help or kind of cause this knee OA presentation later in life. So to start, let's talk about what knee osteoarthritis is. And so the historical definition of knee OA is that it's caused by an excessive amount of mechanical loading through the knee. And in that case, running would probably fit into one of the causes of knee OA if it truly is this matter of excessively loading the joint continuously, then perhaps running could be a cause. However, in recent years, we have seen this definition transition quite a bit, and we know that it's no longer just a factor of how much the joint is loaded, but it's much more multifactorial, and the causes are much more than just mechanical loading. So life stressors and anxiety, sleep, lots of things can come into play, and we can't truly just blame it on loading. So knowing that, let's talk about what the evidence says. So is there evidence to support knee OA and running? What we actually see is the opposite. And so this 2017 study actually suggested that there is a 50% reduced odds of undergoing future knee surgery secondary to OA if you are a runner. This could be due because of that mechanical loading, and that high load cyclical compression of the cartilage actually induces and supports the synthesis of biomarkers that allow and promote cartilage health. So it's actually in turn promoting and encouraging more healthy tissue within the cartilage. In a study, again, from 2017, we saw that there was actually a lower OA prevalence in recreational runners compared to controls who were non-runners. And then you also might be wondering, well, does it depend on how much you're running? Is there an optimal dosage? And so, of course, that has been studied, and we see that at a running volume of greater than 48 kilometers per week, which is quite a high volume actually, we see very negligible differences in terms of the detrimental effects on the prevalence of knee OA. So it doesn't necessarily correlate with how much volume you have in your routine. And then again, there was like a lower overall knee OA prevalence in long-term runners. So someone who's been running 10 to 40 years does not have an increased risk of developing knee OA. That's the knee. We're moving down a bit further into the leg, and we'll talk about shin splints next. So shin splints, the fancy words in the medical community is medial tibial stress syndrome, and this is another overuse lower extremity injury. It's characterized by mostly exercise-induced pain over the anterior tibia, which is the front part of your shin, essentially. Really common within impact sports. So running, jumping sports as well. There's a lot of load that has to be absorbed onto the bone as well. Essentially what shin splints are, it's this unrepaired micro damage accumulation within the bone of that lower part of the shin bone. And so we know with exercise, there is a level of micro damage that has to be repaired. However, if this is excessive and it's not being repaired properly by the body, it can result in shin splints. This is on the earlier end of the continuum in terms of further going on to develop a stress fracture. So you can develop shin splints, and then later on, if that doesn't get resolved, doesn't get treatment, a stress fracture could occur. We see inflammation at the bony site of injury. So the periosteitis is what's happening when the bony membrane becomes inflamed, and those areas correlate usually with tendinous attachments of different muscles, so including the soleus, the flexor digitorum longus, and the posterior tibialis. So it could be as a result of that muscle pulling on the bone. Recommendations, and a really important one is rest and activity modification. So we really need to stress the importance of less repetitive load-bearing exercise so that a stress fracture does not go on to develop. Once you kind of have that good amount of rest and activity modification, we'll go on to start strengthening and stretching through the lower leg and slowly, gradually return back to activity. Moving into the foot. So plantar fasciopathy, or sometimes referred to as plantar fasciitis, the reason for that change in nomenclature is largely because there actually isn't as many inflammatory changes observed as once thought. It's more so a structural change to the tissue. So those terms have been changed, and we're drifting more towards calling it a fasciopathy rather than a fasciitis. The plantar fascia, it's responsible for maintaining the integrity of the arch and essentially absorbing the shock as the body loads through the running cycle. Typically characterized by pain in the morning. So when you first put weight down on your foot, and typically does get better as you start walking around. Risk factors. First one is listed there as excessive pronation, which means that the arch drops pretty quickly without much control. Both sides of the continuum, so a flat or a really high arch can be a risk factor. A tight Achilles tendon, because it's just proximal and just higher than the plantar fascia. And then reduced ankle dorsiflexion. So it's when the ankle comes backwards, is that dorsiflexion movement. And if that's reduced, we see a bit more loading through the plantar fascia. A change in footwear or poor footwear not supporting the foot well can lead to plantar fasciopathy, and then errors in training routine. So we either trained too heavy, our body wasn't ready for it, too much too soon, essentially. Recommendations that we commonly see, perhaps orthotics could be recommended. Again, altering that gait pattern, finding a footwear, a shoe that supports your foot well, modifying activity in the short term. Again, stretching and strengthening exercises for the lower leg and for the foot, and then proper training routines. So you can talk to people in your area or a therapist to help you find that optimal training routine so that things like this don't develop, or if they have, don't develop again in the future. So those are probably some of the most common ones that we see in clinic related to running. So we'll start talking about how to prevent injury, those ones specifically, and strategies to stay basically in running. I have four kind of areas that I want to talk about when we talk about creating a strong running routine. The first one is your training routine. So it's not just going to be running. The second one's nutrition, really important for runners. The third is footwear. So I know that's a hot topic always with running. And then the last one is thinking about the environment that you're running in. So let's talk about a training routine. So if you're not already a runner, how do you get started safely? And it usually starts off by walking. So making sure you are a good walker and you feel strong on your feet, you can eventually progress into running. And I typically recommend this walk run program to start off with. For example, it can look like walking for 90 seconds and then running for 30 seconds, and then repeating that a few times. Typically, I would say to start off about 3 times a week, so you have a rest day in between your training days. You wanna keep your pace conversational, so that means you can maintain a conversation at the level of exercise you're working at. And then you might think about cross training on days off. And what do I mean by cross training? It's basically a way to exercise that is not running. So a way to strengthen your aerobic system specifically that is not looking at running. So things like swimming, cycling, elliptical training would all be ways to cross train. Stretching and strengthening are not considered cross training. Those are considered supplemental to your routine. So it wouldn't replace your running routine. It would be a complement and it would be added into your routine. How do you progress? Where do you go from here? A general safe rule of thumb is to use the 10% rule. And so that means that you're going to increase either time, intensity, or distance by 10%. So you're not going to increase all three. You're going to choose one. So if you want to increase your time, say you went for a 10-minute run the first week, the second week you may try to increase your time by 10%. And it's really important that as you're progressing, you're not pushing through fatigue, because that's often what we see. We see injuries happen. You're pushing too far into the fatigue, the capacity is not there, and you are not able to tolerate that load. Training routines very individualized, and so if you have questions about your routine in particular, feel free to reach out to me or someone in your area to help adapt for you specifically. The other key component to a training routine is this multifaceted approach that includes strengthening, stretching, flexibility, and then this neuromuscular control, balance exercises, and plyometrics. So we see that those who have all of these things worked into a program, much like less likely to introduce injuries. And so on your days off, I encourage you to work through a few of these that are listed as examples. So you can see lots of mobility exercises for your hips and your knees, going into foot strengthening exercises and supporting through the plantar fascia, for example, working through ankle strengthening, prevention splints, working up the chain to focus on strengthening through the quadriceps, the hamstrings, and the glutes especially. And then lastly, the plyometrics portion is important to help tolerate that amount of load and help your body learn to absorb that level of load as well. Next, let's talk about footwear. So this is a really awesome topic to talk about. I feel like I could talk about it all day. But footwear, there's lots of different times and or types, sorry, and different ways to support your foot. So let's break down a shoe. So it's helpful if you have a shoe nearby to look at to sort of compare and to follow along with. But if you think about the upper portion of the shoe, that's the portion of the shoe that covers the top of the foot. So from the heel to the toe, there's different components of the upper part of the shoe. The first one being the toe box. So thinking about the toe box, that's the very front portion of the shoe where, of course, your toes are lying. And you have to think about, is there enough room for the foot to move? Is there enough room for your toes to splay out to absorb the load and to work truly as a foot? The back part of the shoe is known as the heel counter. That's the part that supports the Achilles. This portion of the shoe usually has a little bit of cushioning to it to further support the Achilles. It's usually higher up on the ankle as well to really, really support that ankle. Then the front part of the shoe, again, the tongue and the laces. So as much the tongue is there to help enclose and keep the shoe on, but it's also there to spread pressure across the foot. Last thing you want to think about with the upper is the breathability. So what's the shoe made of? And so looking at the first two images there, you can see the mesh one versus the leather shoe. There's going to be a bit of a difference in terms of how breathable it is. Moving to the next portion of a shoe is your midsole. That's the portion that's between the upper part and then the outer portion of the shoe. This is where we find all of our cushioning for the most part, and it's where we'll find the stability. And when we hear things talking about motion control and pronation controlled shoes, it's usually determined within the midsole. Commonly used fabrics, you see gel cushioning, air foam, those types of things within the midsole of a shoe. And then just above the midsole is the insole, and that you may replace it with an orthotic of your own. Lastly, we talk about the lower or the outer portion of the shoe. That's where we see the grip, the flexibility, and the waterproofness of the shoe. And then there's a few topics that are largely talked about within the running community. So the shank portion of the shoe is where we have a strip or a plate essentially, which will add rigidity to the arch. You might hear things like a carbon fiber plate being added into a shoe, and that's to add rigidity to the shoe to further propel and help push you forward. Then we can talk about a heel drop. That's basically the difference in height between the heel and the forefoot. There's some various differences there in terms of how high it is, and might promote you from being more of a heel striker, more of a forefoot runner. Again, dependent on what your needs are. We will then slide. So here are some examples of running shoes. So the one on the far left, you see the minimalist shoe. That's a really highly debated form of footwear. We do know that there's not a ton of cushioning there, really none at all. And so there's going to be a lot of demand on muscles to have to now absorb that, which could in turn introduce more injuries from that excessive or higher amounts of loading. The middle shoe there is an example of a motion controlled shoe. So there is cushioning, or there is kind of a stability block within the midsole that prevents excessive pronation. So if someone has a low arch, for example, that tends to collapse really quickly under pressure, they may opt for a motion controlled shoe to further support the arch. The shoe in the bottom right is a neutral shoe. So this shoe is designed to cushion. It is neutral in nature in the sense that it doesn't necessarily stop or promote the foot from pronating. These two shoes, the Asics and the Brooks one precisely, they use a bit different technology. So the one in the center will use a bit more of a gel type of cushioning, and the Brooks there typically uses more of a foam. Again, differences in individual preferences in terms of gel versus foam. What is a newer topic supported in research is this idea of a preferred movement pathway. So it's debated whether or not these shoes can truly limit or promote pronation of the foot from happening. So we aren't too sure if it makes a ton of a difference, to be honest. And instead, what we see literature supporting or kind of going towards is supporting what the body prefers. So the skeleton typically has this preferred path of movement, and we are starting to believe that shoe and orthotics should really support the movement pathway. And if we do this, if we support the foot in what feels good and comfortable to the foot, we'll see reduced muscle activity, improved performance, and just better running efficiency overall. It's a newer concept, and it really just does promote and show how individual running and the sport truly is. Next, we'll go on to talk a little bit nutrition. And if you have more questions about nutrition, I encourage you to talk to a dietitian, of course. These are just general recommendations that are supported in the literature. Carbohydrates are, again, somewhat debated within the community, but we know that running it requires a lot of fuel to power, and a lot of that demand comes from carbohydrates. And we see that when our carbohydrate sources are depleted, we see more fatigue and reduced concentration. So we know it's important to refuel with carbohydrates. The box at the top, we see the general recommendations, and of course, it's dependent on how active you are. So about an hour a day versus up to 3 hours, you'll need a bit more carbohydrates, of course, if you're on the higher end of things. And then you think about pre-event, during, and then post-event for your training day. Your kind of your pre-meal or your pre-event type of thing should look like it should have some level of carbohydrate within it. And again, it depends on how long you plan to run for. So if something's under 90 minutes, it's still important to fuel with carbohydrates to make sure that you top off all of your carbohydrate energy sources. But if as you go into greater than 90 minutes or up to 4 hours of exercise, you're going to need a bit more, of course, to prepare you for that event. An idea that you might hear about is this idea of carb loading. So carb loading can be beneficial. So we see an improved performance up to 2 to 3% if that's one of your goals. To help with the performance piece, you can carb load. It totally depends on your system and how tolerant you are to that amount of carbohydrate. During the event, if it's less than 60 minutes, you actually don't need to replenish. Your body will be okay with what you use for your pre-event. If you're going from the 1 to 2.5 hours, you'll see some numbers listed there for recommendations. And then greater than 2.5 hours, you're looking at about 60 to 70 grams if that's tolerable. And then following event, it is important to replenish all of the fuel that you just used. So within the first 24 hours, we're looking at 8 to 10 grams per kilogram per day. Within the first 3 to 5 hours, you want to make sure that you have something to eat as well. That includes some level of carbohydrate. And then the other important nutrition pieces, so your protein, fat, and water intake. Protein's an important component for athletes in general, despite not always being something that's important to runners. It is important for all athletes, and you see what we need about 1.4 grams per kilogram per day for active individuals, versus usually we see about 0.8 for the general population recommendations. With fat intake, we see that it's important to have some fat. It's not the focus here, but we want it to be no less than 20% of your total caloric intake. With water intake, really important to adjust to your individual sweat weights, your sweat rate, sorry. So how sweaty is your t-shirt post run? It might tell you a bit more about how much water you need to drink. The last thing that we will talk about today is the training environment. So it is a bit different in terms of, are you training on trail or are you running on a road or on a pathway, essentially? We see trail running to be a bit more demanding in terms of tissue load. So for instance, we see that there's a lot more eccentric and concentric leg strength that's required. So basically, it's both our quadriceps and our hamstrings will have to activate together to control the movement. And that's a really challenging thing for the body to have to coordinate. The second thing is that neuromuscular control, or that balance thing. So we're on more of an uneven surface. There's the tree roots, there's sticks and stones, and that requires more balance essentially, right? The next part, so the knee flexion. So as you're running downhill, you're going to have to absorb, your knees are going to bend a bit more to absorb more of that load as you run downhill. Again, you're going to need trunk control and core activation to stabilize on those uneven surfaces. And then again, going back to the downhill, as you're running downhill, you're going to need to brake a little bit. You're going to have to slow yourself down, which is actually a bit more of a demanding task, despite sometimes running downhill feels a bit effortless. It's actually really challenging for our muscles to control to prevent us from falling to the ground. And then we always want to make sure that we have a stable foot landing on those uneven surfaces. Again, really important to have that appropriate ankle range to allow your body to bend and work with the surface. So let's talk about a few take-home points as we wrap up here. So the first one, be consistent. It's not an easy thing to get going if you're a new runner. So be consistent with it. Keep up with your stretching, your strengthening, and your nutrition. They are all factors that will help you become a better runner. More things go into it rather than just running alone. The second thing is to listen to your body. Our bodies will communicate with us. Take time to check in with yourself. What works for someone else and someone else within the running community may not be what works for you. So whether that be a pre-event meal or whether that be a shoe that works really well for them, it may not be what your body needs particularly. And then the last thing, I encourage you all to ask for help when you're unsure. So I'm sure there's many people in your area that can help out, whether it be a running coach, a physio, a chiro, a dietitian, a podiatrist if you're interested in orthotics. There's lots of people around who are willing to help, as well as myself. If you have any questions about yourself in particular, feel free to send me a message, and I'll be happy to help you out there. Some references if anyone wants to glaze over them. And then, yeah, I thank you for listening in today. And if you have any questions, shoot me a message, or Tage, if you have any questions, let me know. But thank you.
Wonderful, Jessica. Really good. I
Thanks,
learned a
Tage.
couple of things new about the footwear, about the nutrition.
Awesome.
Very nice. Yeah.
Great
Thank you
stuff.
so much.